I am Dr. Iulia Tulai. I'm one of the general non-invasive cardiologists at Swedish Heart and Vascular Institute in Seattle. When I first see a patient and during our first consultation, it's always a more expensive consultation than our usual follow-up. And that's because one of the most important things to me is that the patient understands why they are there and they understands their own condition. And I feel like if the patient understands what is happening to their heart, why is happening to their heart, this enables a very good patient-physician partnership. And from that point on, they understand why I'm making the recommendations that I'm making, why we are doing everything we are doing, why sometimes we need to see each other more frequently, at least at the beginning. During that initial consultation, I present the cardiovascular condition and the explanation, but they can also tell me what they value in their life, what they see their life as, what is important to them, and enables me not only to deliver a very, I hope, appropriate medical care, but also individualized to my patient's own wishes. One of the things that I always remind my patients is that there's no one thing that you could do to keep your heart healthy. It's always a combination of things, and a lot of times I actually say 1 + 1 = 3. Because there's no drug that we can give you that would solve anything. There's no treatment that we could give you that would solve everything, but it's a combination. And it starts with you being very mindful about your body, about how much you exercise, about what you eat, and on top of that is the treatments that we are providing you. Swedish Heart and Vascular Institute is one of the top cardiovascular institutions, not only in the Northwest, but also one of the top institutions in the country. And I feel like no matter what treatment my patients would need, I can offer them everything here. And not only I can offer everything here, but that care is at one of the highest standards in the country as well, because we are working with some of the best specialists in the country, not only in cardiology, but in all cardiovascular fields and subspecialties such as structural heart disease, advanced heart failure, electrophysiology, surgery, and I could go on and on. And not only I feel comfortable with the patient that with the care that my patients are getting here, but I would feel perfectly comfortable if even my own family would get care here.